From WFRV TV Local 5, your local election headquarters, this is Newsmaker Sunday with your host, Tom Zalaski.
Good morning. Welcome to Newsmaker Sunday. I'm Tom Zalaski. Our topic this week is the troubling issue of increased domestic violence and child sexual abuse during this coronavirus pandemic. According to the Rape, Abuse, Incest National Network, there was a 22% increase in crisis calls from people under 18 in late March, with much of the country under lockdown. 67% identified their perpetrator as a family member, and 79% live with that perpetrator. We have two experts with us this morning to talk about this issue. Tanya Dietering is the Executive Director of Golden House in Green Bay. Jody Nuthals-Mikulski is the Children's Advocate, also with Golden House, and we thank you both for joining us this morning, ladies. Jody, I want to start with you. What are you seeing when it comes to child abuse cases since this shutdown began?
Tom, I don't know that I can speak specifically to child abuse cases because I don't have the access to that information. I don't work for, that would be at the county that would have that level.
Now let me put it this way. Tanya, some people are calling this a perfect storm situation. You got kids kept at home. Stress is rising in the household. In some cases, there's no more paycheck coming in. Are you seeing some of this from your perspective?
You know, at Golden House, we've seen clients come in with extreme concerns over the safety of their family, the uncertainty of either losing jobs, the income being reduced, the increased anxiety in the home. It's real, and it's definitely happening within our community.
Now, Jody, a lot of these kids are in situations where they are not before the eyes of these so-called mandatory reporters, things like school teachers and coaches and adults who might be in charge of extracurricular activities. So they don't have an outlet to tell anybody about something going on. How serious of a problem is this?
Well, I think it's very serious. Children need that relationship with an adult to feel safe and have that conversation when they're feeling uncomfortable with something that might be happening to them. And they're not at liberty to do that at this time. Even if they are in contact with teachers, it's oftentimes in a family area or a living area where all of the family members are present and you can't have those personal conversations.
Yeah, essentially this lockdown is preventing a child, preventing a kid from reporting just because of the closeness of the situation in the household. Is there anything that these kids can do? I mean, you know, we could ask a relative or a friend to look and see if there's any change in that situation, but really under the Safer at Home, the relative and friend is not even supposed to be in that household.
Yeah, probably not in the household, but I would encourage family and friends to reach out to people who they might be concerned about, to have a telephone conversation or a Skype conversation with somebody and just make sure you're staying in touch.
Now, Tanya, how has your operation, Golden House, has it changed during this coronavirus pandemic? I know you've got, what, 11 rooms there. You can handle somewhere around 44 people. What's the situation there?
Yeah, you know, great question, Tom. Our business has changed substantially since the middle of March when Safer at Home was enacted. We've pivoted. We've had to look at different ways of delivering services, which includes a lot of new technology. As you can imagine, in a human services agency, face-to-face, person-to-person meetings and helping individuals is what we're all about. So when the pandemic hit and Safer at Home kicked in, we quickly had to look at different ways we could help and continue to support our families. So we've been very fortunate to have received funding from some of our local community funders through the Packer Foundation, as well as the Greater Green Bay Community Foundation, the Brown County United Way, which has helped us be able to purchase some technology and to make sure that we're equipped to continue the same services that we've had before. So what that is we are continuing with our 24-hour helpline, which has been significant increased calls coming in the last 2 months. We continue to have our our services such as mental health therapy over the phone. Some of the children's advocacy and family discussions are over the telephone now. We continue to have our crisis calls over the phone. So while the way we've done business has changed, the impact continues to be seen. And in fact, we've had increased calls and contacts with our victims, now survivors.
Jody, have you been able to tell over the past month or two, have calls coming in increased at all?
Yes, I believe they've increased, and I'd have to talk to Tanya about the percentage, but it was around 80%, I believe, for the phone calls. That's correct?
Yeah, so for the month of
calls than typical. Go ahead.
The month of March, we saw a significant increase compared to the month of February. In fact, it was an over 80% increase. So the calls have increased significantly, and that maintained in April. We had over 800 helpline calls coming into Golden House in April alone.
That's substantial. How have social workers changed their duties during these past couple of months? Because they obviously have limited access to the people they're supposed to be working with.
Yeah, the way that we've delivered service has changed significantly. So our advocates are social workers, if you will, and what they have done is they've had mobile advocacy be their main tool for being able to help clients. So now that's telephone calls. Soon, in fact, probably as early as next week, we'll be trialing Zoom, a safe, secure, and confidential version of Zoom. So for those clients who are able to and willing to do video conferencing, and some are, we'll have that ability to help our clients as well.
Now, Jody, we've never been in a crazy situation like this ever in our history. Are you seeing families who are reaching out who previously were not considered to be in at-risk situations and suddenly they find themselves to be so?
I don't know that we've seen an increase in the number of calls of people that are new to us. I think we are seeing, I guess we're seeing a number of calls from people that we've worked with before, as well as new people that haven't reached out in the past. And some of it is the power and control as it relates to the COVID. So maybe more isolation is probably the biggest piece that we see. They don't have family and friends, and we know that that's a huge part of power and control, is to isolate from family and friends. And this is a perfect storm or opportunity for someone who uses coercive control to utilize the isolation piece to make sure that the person they're trying to control is unable to reach out for help and to just even talk to family or friends or have that extra support.
And this is quite the time of stress for a lot of people, and it's resulting in mental health issues as well. So how do you spot some of these cases when you're having to deal with people as we are right now remotely? You're not doing a one-on-one.
That's actually kind of hard, because how I read people is through body language. And when I don't have that in front of me, I have to listen very hard for the words they're using. I have to ask the right questions. And kind of read through what they're asking me and what they want to know. And it is a bit more challenging to do it that way.
So, Jody, if and when you do get a chance to talk with a child or a teenager who's going through a difficult time, often a dangerous situation, what are you telling them to help get them through this situation? And I know you've never been through this either.
Yeah, I've never been through anything like this, so we have to be creative with our thoughts. I do believe that all change in children happens in relationship, and that if they can connect with an adult in their household or an adult in their life who is safe and somebody that they could talk to about things, I encourage them to think about who are those people, where are safe places. We can still go outside, right? We can still be away from the household and do that safely with COVID. We have to do it certainly with social distancing, but finding ways to connect with adults in their lives, whether it's video or audio, getting outside and just being away from the situation if they can. Certainly not the ideal safe situation, but removing yourself is if you can be really helpful. And then again, connecting with adults.
We have much more to come, and we continue our conversation right after this, so please stay with us.